Alright, Diana, so today we're going to be using IFC, and what that is interferential current, and it is electrical impulses that go into the tissue as well as the muscles. And what that really consists of is there's 4 pads usually, because the area depends. There's either 2 if it's a very small area, but usually it's most effective for 4 in most parts of the body. So that usually means that for 4 pads there's a cross current, and the targeted tissue is right in the middle, and the difference is usually between 80 and 150 megahertz for acute and between 110 megahertz for chronic, depending on the pain. The reason that we use this is because it allows us to decrease pain levels that the patient's experiencing. It allows us to increase range of motion as well as decrease muscles spasming and guarding. But there are a few things that we have to make sure before we use IFC. So some of the precautions is we can't put it on the temples, the eyes, mouth, front of the neck, groin, as well as areas that have altered skin sensation. Contraindications for IFC, which means we can't use it, would be if you have any of the following. So I'll just list them out to you. Do you have a pacemaker at all?
No.
Do you have any infections?
No.
Are you by chance pregnant?
No.
No? Okay. Do you have any types of cancer?
No.
No? And so those are a few of those. That's okay. In terms of the benefits of the treatment, since you're coming in with low back pain, it is deemed reasonable because it will target the tissues, because as you said you didn't have any of the indications and it's not in any of the precautions, and it will help you regain some of that normal feeling without pain and tightness that you might be experiencing. So how this is going to work is that I'm going to be placing 4-pad application on your back with the targeted spot in the middle. Since it is acute, which it's recent since you've had this pain, I'm going to be doing 80 to 150 megahertz. There will be between 10 to 20 minutes of application. So once I place the pads on with the red to head method, so I'm going to be placing the red current, well that's not typical for the 4 pads, but I want to make sure that the appropriate cables are crossed to ensure that there's proper signal. So what's going to happen is once I start turning on the machine for the time, you're going to start feeling a tingling sensation in the middle, kind of pins and needles type aspect, and I'm going to turn it up until it's strong but it's comfortable. So I don't want it being overly painful, I don't want it being not feeling at all. And once you reach that point, I'll keep it there. And then as the treatment prolongs, you might lose that sensation of the tingling, you might not feel anymore. I want you to let me know when you feel that so I can keep turning up so you constantly have that feeling, okay? But I want it to be strong and comfortable. So before I begin, do you have any questions about the treatment?
No.
No? And also before you begin the treatment, I just want to be able to distinguish with you between hot and cold, just in case you do have any sensation issues in that area, because I don't want to be applying IFC if you have altered sensation due to possibly burning you, because it could get hot due to the energy going into the muscles, okay?
Oh.
So beforehand I'll just check temperatures.
Okay.
So before I begin, do you have any questions before we begin treatment?
No.
So do I have your consent to do IFC?
Yep.